We all have the potential to develop cancer. We're probably exposed to carcinogens every day. In fact, 1 in 2 men and 1 in 3 women will develop cancer. And cancer is on the rise for people under 50 years old. I hope this is a wake-up call for all of us because the risk is high. Welcome to 7410 Style. If you're like me, you're wondering what the risks are and how you can improve your survival rate if you're diagnosed with cancer. Let's start at the end of cancer. Cancer is the second most common cause of death in the United States, with over 609,000 deaths in 2022. It's also one of the leading causes of death worldwide, almost 10 million in 2020. Which are the most common cancer deaths? The top ones in 2020 were, in order, lung, female breast, prostate, colon, pancreas, liver, ovary, leukemias, uterus, and non-Hodgkin lymphoma. Just a side note, these are based on age-adjusted rates, so the absolute numbers will have a different ranking than these rates. This allows us to compare cancer mortality rates over time. Working backwards, let's talk about treatments. Nowadays, we talk about surgery, chemotherapy, and radiation therapy as if they are easy. They are definitely much more common than the cauterizations done for tumors of the breast in Egypt around 3000 BC. But don't think that they are easy recoveries even today. Recovery from surgery can take a few days, a few weeks, even a few months. A rule of thumb for recovery from chemotherapy is about 2 months of recovery time for every month of treatment. My aunt's recovery from chemotherapy for breast cancer had to be stopped midway because the poisons were devastating her body. My dad couldn't even sleep in bed after chemotherapy because he was in such pain. Thank goodness my mother and brother were there to help him. Recovery from radiation therapy may include side effects that last for weeks to months. There are physical and emotional challenges to cancer recovery, managing pain, fatigue, anxiety, depression, and lifestyle changes. We don't want any of this 7410 Style if we can help it. So what can we do? Early diagnosis can reduce the risk of death and increases treatment options. There are several ways doctors detect cancer. 1. Screening tests. Along with physical exams, there are 5 recommended cancer screening tests. Physical exams check for visible signs of cancer like lumps, abnormal moles, or enlarged organs. An example of a screening test is a mammogram. That's X-ray imaging to find breast cancer or breast changes before symptoms develop. Another example is a prostate-specific antigen, PSA test, a laboratory test to measure the level of PSA in the blood. A colonoscopy is another example. The doctor checks for polyps or cancer inside the rectum and the entire colon using a thin, flexible tube with a camera and light. 2. Galleri test. The Galleri test is a new type of blood test that detects more than 50 types of cancer. It looks for cell-free DNA and identifies whether it comes from healthy or cancer cells. It is for adults at higher risk for cancer, such as over 50 years of age. It's currently available by prescription in the US and is being tested in a large clinical trial in the UK. My brother recently took this test. He paid $650 that his insurance did not cover, but it was worth it for his peace of mind. 3. Recognizing symptoms. You are the best judge of your body. Your body acting in an unexplained way that doesn't go away should prompt you to investigate it. Consider the symptoms of the 4 most common cancer deaths. Some common symptoms of lung cancer are a new cough that gets worse, coughing up blood, and chest pain that is worse with deep breathing. Some symptoms of breast cancer are a new lump in the breast or armpit, redness in the nipple area, and pain in any area of the breast. Some symptoms of prostate cancer are difficulty starting urination, blood in the urine, and pain in the back or hips that doesn't go away. Some symptoms of colorectal cancer are blood in your stool and abdominal pain that doesn't go away. These are just a few symptoms. There are more. The hard part is knowing whether it's cancer or something else that's causing these symptoms. So go see your doctor if you develop any of these symptoms. But the best way to reduce the risk of cancer is to change your behavior. We know that everyone is at risk of developing cancer. What increases the likelihood? Age is a big factor, and it's a growing concern for younger people, but it's nothing that we can change. There are other behaviors that we can change. Some behaviors like smoking, having excess body weight, drinking alcohol, and eating an unhealthy diet can all increase risk. The research shows that animal-based foods, including dairy, are associated with cancer. It's not clear whether it's the lack of whole plant-based foods or the majority of animal-based foods in the diet that impact cancer. For example, women who consume a diet rich in animal-based foods with a reduced amount of whole plant-based foods are exposed to excess amounts of female hormones, including estrogen and progesterone, which increases breast cancer risk. What has also been shown is that different aspects of animal-based foods are associated with different cancers. An enormous body of evidence shows that animal-based foods are associated with prostate cancer. In the case of dairy, the high intake of calcium and phosphorus also could be partly responsible for this effect. Dietary variables were strongly correlated with several types of cancer, particularly meat consumption with cancer of the colon. Eating a diet naturally high in fiber and low in animal-based foods can prevent colorectal cancer. There is too much evidence now. Your doctor should discuss changing your diet as a potential path to prevent and treat cancer. This is also a moral and ethical choice. Intensive animal agriculture causes great suffering to animals and contributes to global warming. What steps are you taking to prevent cancer? We'd love to hear in the comments below. Our weekly email newsletter is free, 7410 expanded on Substack. Follow this link or the link in the description. Hey, we really do appreciate your support. Please like, share, and subscribe for more. Change your lifestyle to reduce the risks of cancer. And remember to take it one day at a time until it's 7 days a week, forever 10.